Good morning. This hearing is called to order. This is a public hearing of the City Council Committee on Public Health and Human Services, and the purpose of this public hearing is to hear testimony on Bill number 190505. I'd like to recognize the presence of a quorum of committee members. Members of the committee in attendance are Councilman Bill Greenlee, Councilwoman Blondell, Reynolds Brown, and Council President Darrell Clark. And now if we can have the clerk read the title of the first bill.
Bill number 190505, amending Title VI of the Philadelphia Code entitled Health Code by adding a new chapter 6311 entitled Children's Meals at Food Service Establishments.
Okay, and if we could have the clerk call the first panel to testify.
Tom Farley, Commissioner, Department of Public Health.
Good morning, Commissioner. Before you make your remarks, Councilwoman Blondell, Reynolds Brown would like to be recognized.
Thank you, Chairwoman. Good morning.
Good morning.
To Councilwoman Bass, Chair of this committee, and members of this committee, I do want to say thank you very much for the brief remarks on this legislation that has not taken as long as some other major issues we've tried to help on behalf of children. Bill 190505 takes another step in the city's effort to combat the dangerous health effects of obesity. By requiring restaurants to list healthy beverages when designing menu items for children, we help young people develop healthy habits early that will last them a lifetime. I and my staff and I are proud of the legislative record of City Council when it comes to taking action to improve the health of all citizens, but most particularly the most vulnerable among us, children. In 2010, after nearly 2 years of conversation, discussion, negotiation, and compromise, the City of Philadelphia implemented one of the first menu labeling bills in the country. In fact, I think we were the third behind Seattle and New York. That legislation became a model for a nationwide bill that was eventually signed into law nationally. President Barack Obama, in fact, Michelle Obama, came to the city of Philadelphia to speak about our menu labeling bill, and then they used some of the language for the Affordable Health Care Act. Fast forward to last year, my office worked very, very closely with the health commissioner and introduced legislation requiring sodium warning labels on menu items that have as much sodium as a person should eat during an entire day. After many more months of negotiation and compromise, that effort also received the support of each member of City Council, and the good news is that this goes into effect on menus this week. Thank you, Commissioner. Today, we zero in on the contents of children's menus. The fight against obesity in children is a critical one for every Philadelphia neighborhood. Approximately 41% of the young people in our city aged 6 to 17 are overweight and obese, 41%, which is 8% above the national average. Data reveals that overweight children and adolescents are more likely to become overweight or obese as adults. And when it comes to childhood obesity, we know that the consumption of sugary beverages play an outsized, oversized role. In fact, I call sugary beverages liquid sugar. Just one 12-ounce can of soda every day for 1 year is equal to 55,000 calories or 15 pounds a year. The school district and the city of Philadelphia have taken steps to remove unhealthy beverages from the list of options for young people. I might note that it was my office again that recommended more than 10 years ago that we take sodas out of our public schools. And after much debate and negotiating with the school board, the compromise was to take sugary beverages out of schools for grades K through 8. In this effort, we were proud to work with a number of stakeholders. I want to thank in particular the American Heart Association and the American Association of Pediatrics for your leadership and stewardship of this particular legislation. And also again to our Health Commissioner, Tom Farley, and all the members of your team. I want to thank the others that we sat down at the table with many times, the National Beverage Association, the Pennsylvania Restaurant and Lodging Association, and representatives from local beverage distributors like Coca-Cola and Pepsi for your authentic engagement. It was important, civil, respectful conversation. It must be noted that a number of the restaurants and beverage companies have already taken steps to ensure kids include healthy beverages. McDonald's, for instance, recently changed their recipes for apple juice and chocolate milk, respectively, on their children's menu. Because McDonald's decided to be proactive, they will easily be able to comply with this new requirement. Before we proceed to testimony, I speak briefly to the amendments that have been circulated. The amendment, you know what, I think I'll wait and do the amendments when we get to that.
Okay.
Is that all right?
That's fine.
Okay,
That's fine.
so this is a lot of content, so I'll wait till we hear testimony, and then when we move to action on the bills, speak to the amendments. Thank you, Madam
Very good.
Chairwoman.
Thank you, Councilwoman. Okay, and we can now have our testimony from Commissioner Farley. Good morning. Please state your name for the record and begin with your testimony.
Good morning. Morning, Chairperson Bass and members of the Public Health and Human Services Committee. I'm Dr. Thomas Farley, Health Commissioner for the City of Philadelphia. Thank you for allowing me to provide testimony on Bill number 190505, which, if enacted, would require food service establishments that offer children's meals to offer only healthy beverages as default choices. Obesity in early childhood is associated with 5 times the risk of adult obesity, and obesity in adults increases the risk of hypertension, diabetes, and respiratory, joint, and mental health problems. Today, 22% of Philadelphia's children are obese, posing a serious threat to their future health. Sugar-sweetened beverages are the largest source of added sugar in the American diet. Consumption of these drinks has been linked to higher rates of obesity, diabetes, heart disease, and dental caries. It is not a habit we should be encouraging in our city's children. Children eat at restaurants frequently, consuming about a quarter of their total calories at these establishments. Children who consume combination meals at restaurants are more likely to drink sugar-sweetened beverages and consume significantly more calories, about 180 more on average, than other children eating at the same establishments. The inclusion of sugary drinks in meals labeled as children's meals sends a dangerous message to parents that there's nothing wrong with children consuming these beverages regularly. Bill number 190505 can help change that message. It requires that children's combination meals offer, as a default choice, healthier beverages, including water and milk. If they want to, parents can choose to purchase sugary drinks for their children, but we know that people very often accept the default choice presented to them. This bill supports the Health Department's efforts to combat childhood obesity by recommending that parents avoid giving sugary drinks to children, and for this reason, we are supportive of the bill. My one recommendation for the bill is to exclude fruit juice as a default option. The high sugar content in fruit juice, including 100% fruit juice, contributes to the increased calorie consumption and the risk of dental caries. The American Academy, American Academy of Pediatrics has stated that fruit juice offers no nutritional benefits over whole fruit for infants and children. It has no essential role in healthy, balanced diets of children. Philadelphia's Board of Health took these recommendations into account when it passed its resolution on childhood obesity prevention and early childhood care, which states that early childhood care providers should neither provide fruit juice nor permit its provision to children in their care, including 100% fruit juice. And I might add that a lot of 100% fruit juice has more calories per ounce than Coca-Cola does. This bill would build on an important public health contributions of Philadelphia City Council has made through its passage of the Philadelphia beverage tax. As you know, this tax helps children by funding pre-kindergarten, community schools, and the renovation of parks and recreation centers, but it also is a powerful public health tool to decrease consumption of sugary drinks. With a minor change to remove fruit as a default beverage, Bill number 190505 could also make progress in efforts to combat obesity by helping to decrease sugar consumed by the city's children. Thank you for the opportunity to testify. I'm available to answer any questions.
Thank you, Commissioner. I do have one question.
Yeah.
In your testimony, you stated that children that eat at restaurants frequently consume about a quarter of their total calories at these establishments, and those who consume combination meals are more likely to drink sugar-sweetened beverages. And I'm just curious about that information, that data.
Yeah. Can
you discuss that a little bit further? Because it doesn't seem to me to be a natural thing that because you're eating a combination meal, that you are consuming more calories than if you were not having a combination meal. So can you just explain that to me?
Yeah, that just comes from a study where they just collected data on people going to chain restaurants. Excuse me. And that's what they found, is that the kids whose parents purchased combination meals for them were more likely to consume sugary drinks and consume substantially more calories.
Okay.
You know, we all are busy, and so we tend to go with default choices given to us.
Sure.
Even though we have our ability to choose, and a combination meal, at least until recently, typically a sugary drink was the default beverage. And so parents said, give me a combination meal because they wanted a toy maybe, and they got a soda so the kids consume more.
Okay.
So this changing that default would make a big difference while still preserving choice.
Okay. Councilwoman?
Thank you, Commissioner. I want to further comment on the view or perspective of the American Association of Pediatrics and the concern that fruit juice is being included. And I need to quote and put on the record an additional information from the American Association of Pediatrics where they say, and I quote, 100% fresh or reconstituted fruit juice can be a healthy part of the diet of the children older than 1 year when consumed as part of a well-balanced diet. But to punctuate your point, they say, and I repeat what you stated, fruit drinks, however, are not nutritionally equivalent to fruit juice. End quote.
Yeah. If I can explain that
Please,
further.
please.
Most of what children consume that parents perceive as fruit juice is in fact fruit drinks. And it's got a little bit of fruit juice in it and then a lot of sugar and water
That's
in it.
right.
Your typical, juice box, which parents think of that as healthy these days, and it's basically, a soda without the carbonation in it. It's not healthy, and that's the biggest consumption of sugary drinks among small children these days. And so fruit drinks are a real problem from our perspective. Even the 100% fruit juice, though, doesn't really solve that problem. That has a lot of calories as well, and we don't think it's necessary. So we would recommend that you not have that as a default.
Okay. All right, then. I thank you, Councilwoman.
Thank you. And if there's no more questions from the panel for the Commissioner, thank you so much for your
Thank you.
testimony. If we can have our next panel come forward and have the clerk read the names of the next panel.
Jacob Zajic, American Heart Association. Dennis Ortiz, American Heart Association.
Good morning.
Morning. Good morning.
Please state your name for the record and begin your testimony.
My name is Jacob Zajic, and I'm with the American Heart Association. Okay. Good morning, and thank you for the opportunity to speak to Chair Bass and the other members of this committee. My name is Jacob Zajic, and I am the Community Advocacy Director with the American Heart Association here in Philadelphia. As part of our community impact team, I've had the opportunity to work with Chef Dennis Ortiz and other fantastic volunteers who have engaged the community to improve health outcomes to live longer, healthier lives. Our work has taken us to non-traditional spaces, including churches, schools, and a whole slew of community partners. We continue to hear from families that there's a need to make the options where they consume their food from healthier, and that is why we are supportive of Councilmember Reynolds Brown's legislation, Bill 190505, that would make the default beverage with children's meals sold in the city water, milk, or 100% fruit juice. We believe at the American Heart Association that this bill will continue to develop healthier eating habits for children. As we spoke to Philadelphians and neighborhood community organizations, one thing was clear. We need to develop a policy that would have an immediate impact on families with young children. We learned that nearly 85% of families in the nation eat out at restaurants at least 5 times per week. That is why I'm here this morning, to continue the great steps and work done by the Department of Health led by Commissioner Farley, Councilwoman Blondell Reynolds Brown, and the entire Philadelphia City Council. We need to continue this proactive approach to improve health disparities seen in our city. The American Heart Association is supportive of this bill, 190505, which would make the beverage default option include with children's meals sold in the city, water, milk, or 100% fruit juice under 8 ounces. We believe that this is an important step to improve healthy options that many families purchase their food from and making the healthier choice the easier choice. Before I conclude this morning, I want to thank Councilmember Reynolds Brown for her over 2 decades of incredible service to children and nutrition policy in our city. Thank you, Councilmember, and look forward to continue the work together to improve thousands of lives for our youth in Philadelphia. Thank you.
Thank you for your testimony. And if we could have you state your name for the record, sir, and begin your testimony.
Good morning, council members. My name is Dennis Robert Ortiz, and I am here to share my testimony. Hello, everyone. Like I said, my name is Dennis Ortiz. I would like to thank the committee, first of all, for Public Health and Human Service, specifically Committee Chair Cindy Bass, for this hearing and allowing me to take the time to speak this morning. For the last 3 years, I've been given the opportunity to be a healthy cooking instructor with American Heart Association. I have been leading cooking demonstrations while I also work to be a healthier version of myself. I believe that a lot of the choices that I made when I was younger contributed to the hardships I face until this day. My goal is to work with youth to develop healthy eating habits at an early age that will stand for the rest of their lives. Today, we're not asking for much. All we want is to implement a healthy drink options at restaurants, which would be a great start in motivating our youth to live a healthier lifestyle. As of 2018, 22% of the children in Philadelphia suffer from obesity, with the rate only worsening. And like Jacob said, 85% of families do eat out 5 or more times a week. African American kids and teens see twice as many ads for sugary drinks than their white peers, while marketing towards Hispanic kids went up over 45% over the last 3 years, especially on Spanish-speaking television and radio stations. Despite claims by 45 restaurants to offer healthier drink meal options, research shows there was no improvement to calories, sodium, and saturated fat kids' menu items that had been offered. With about 1 in 5 children in the city impacted by obesity, I believe that it is important to enact a healthy by default children's meal policy that would make a healthier choice the easier choice for families today. That is why American Heart Association and I are supportive of a kids' meal policy that would remove sugary beverages from kids' meals sold in the city, while offering a healthier option such as water, skim milk, or 100% juice. Once again, I want to thank all the council members on this committee who work tirelessly to improve the health of our youth. Thank you very much.
Thank you, and thank you both for your testimony today. I do want to acknowledge that we've been joined by Councilman Derek Green, who's a member of this committee. Any questions from the panel? Sure, certainly. Councilwoman Blondell, Reynolds, Brown.
Thank you very much. I do need to say thank you, and I am always grateful that it was Mayor John Street and his wife Naomi Post Street who actually recommended me to be a Robert Wood Johnson Fellow, because they saw very early on my interest in the life chances of our city's children. And so I credit them for planting the seed and helping me grow in a space that was not terribly new, since early in my career I spent it focusing on children, but giving me a chance to really deepen and narrow my interests around the health of children. So this really, 19 years later, is a continuation of their willingness to give me that chance. So I thank you for that compliment very, very much.
We really appreciate it. Have a great day.
Thank you.
Thank you very much for your testimony.
You as well.
And if we can have the clerk call the last panel to testify.
Barbara Gould, Sarah Hussein, Huntley Hardison, Jessica Perfetto.
Good morning.
Good morning.
Good morning.
And if you want to state your name for the record and begin with your testimony.
Good morning. My name is Barbara Gould, and I've been in general pediatric practice in Philadelphia for more than 35 years, which is why I took the time to come here this morning and talk about the importance of the Healthy Kids Meal Bill. I think all of us in this room know how incredibly hard it is to change eating patterns, our own or other people's. And that is why every single thing that we do as politicians, healthcare workers, and public health officials is so important to improve diet at a young age before habits become ingrained. This is so important. When I started in practice, I had perhaps 1 or 2 children with type 2 diabetes in my practice. By the time I retired 4 years ago, I was diagnosing it and seeing patients with it on an almost weekly basis. The CDC now estimates that 40% of the population will develop type 2 diabetes in their lifetime. That is a staggering number of people who will suffer and who will require expensive health care for many, many years. I often told parents that soda is nothing more than a candy bar in a can, knowing that they were unlikely to let their kids have candy for breakfast or in their baby bottle, both of which I have seen even in my office, when you assume that they maybe were a little worried about what I was seeing. The American Heart Association says that no child should have more than 1 8-ounce sugary drink per week, but that guideline is followed by very few. Those of us in this room are concerned about public health, and I see it as our responsibility to do what we can to help parents make sure that their kids are as healthy as possible. I often had to remind my office staff that no one intends to raise a child with poor health habits. But there are so many factors that promote unhealthy habits that we must use every rule, law, or policy we can to counteract the promotion of these unhealthy drinks by the beverage and sugar industries and the national agricultural policies that encourage them. In 2004, the school district approved a regulation, has been cited previously, limiting beverages in school lunchrooms and school vending machines to 100% fruit juice, milk, and water. The regulation was developed in coordination with the Food Trust as part of the School Nutrition Policy Initiative, working with the SRC and City Council. This sent a clear message to kids, parents, the schools, and the public about what beverage choices were healthier. Today, we can add to that initiative by mandating that restaurants offer all these healthier choices as the default option rather than soda, since evidence from a wide range of fields, including retirement plans, organ donation, and healthcare, shows that people tend to stick with default options and that setting beneficial defaults has a high risk of acceptability. 91% of parents buy at least one lunch or dinner for their children at a fast food restaurant every week. This is a very big deal, this bill. And I will add parenthetically that the American Academy of Pediatrics and I would much prefer that it was just plain milk and water, not 100% juice, but it's better than soda, as has been already commented. The Food Marketing Work Group says parents play a central role in determining what their children eat. However, restaurants should support, not undermine, parents' efforts to feed their children healthfully. I urge you today to help parents do what they know is best by approving this bill. Thank you.
Thank you for your testimony. And sir, you may state your name for the record and begin.
Good morning.
Good morning.
Chairperson Bass, committee members, fellow speakers, ladies and gentlemen. It is an honor to address you on an important policy proposal to help promote healthy nutritional habits among the youth of Philadelphia. My name is Huntley Hardison. I am a retired pediatric neurologist. In addition to working for 25 years in the section of neurology at St. Christopher's Hospital for Children, I consulted at many hospitals in the Delaware and Lehigh Valley areas, whereas the bulk of my practice focused on children with nervous system disorders. I have experience in medical epidemiology, general medicine, pediatrics, psychiatry, and neurology. I'm board certified in pediatrics as well as psychiatry and neurology with special qualifications in child neurology. I'm a fellow of the American Academy of Pediatrics and the American Academy of Neurology. According to the National Center for Chronic Disease Prevention and Health Promotion, the leading causes of death and disability are heart disease, cancer, chronic lung disease, Alzheimer's disease, diabetes, and chronic kidney disease. These are chronic diseases that afflict 60% of adults. 40% of us have 2 or more of these conditions. The risks that lead to these chronic diseases include tobacco use, poor nutrition, lack of physical exercise, and excessive alcohol use. Today, you are hearing testimony in favor of Bill number 19050. I support the bill and urge each of you to vote in the affirmative. The bill directly addresses one of the lifestyle behaviors that increases one's risk of suffering from diabetes, in that the bill mandates a food service establishment that offers a children's meal to offer a healthy beverage choice like water, non-fat milk, or 100% juice. A healthy by default children's meal policy will continue Philadelphia's proactive approach to improve health disparities. Restaurant food and beverages account for about 25% of a child's caloric intake and often come in the form of pre-packaged children's meals. In Philadelphia, where nearly 1 in 5 children are impacted by obesity, it is imperative to continue our work improving access to healthier food and beverage options in food establishments from which families frequently purchase their meals. Over the past several decades, the world has become increasingly aware of the role of added sugars, particularly in beverages, as a major driver of increased weight gain and diabetes. The consumption of sugar-sweetened beverages is on the rise worldwide and is driving an increasing incidence of obesity, diabetes, and other diseases of circulation and metabolism. Many countries have tried many different kinds of interventions to help reduce popular consumption of sugary beverages, and the most effective one has been taxation of sugar-sweetened beverages. Other interventions that should be effective but are in need of further study include public awareness campaigns, front-of-pack labeling, and substitutes for sugar-sweetened beverages. Examples of substitutes have included unsweetened or lightly sweetened water, milk, tea, or coffee. Bill number 1090505 appropriately addresses the last option. Now is the time to implement the program. After implementation, one should monitor the resulting changes in dietary and marketing behavior among school-aged children and the community. As a neurologist, I am concerned about the impact of diabetes on the nervous system, in particular, diabetic neuropathy and memory disorders. Diabetes-associated nerve damage leads to distal numbness, skin ulcers, and chronic pain that is unbearably similar to electrical shocks. In addition, patients with diabetes may lose automatic nerve control of vital body functions. Diabetes-associated nerve damage affects 90% of patients with diabetes. It is a major reason for the increased cost of diabetic health care. Recent information from the 70-year-old 3-generation Framingham Heart Study in Massachusetts addresses the relationship between frequent consumption of sugary drinks and early signs of Alzheimer's disease. Data analysis shows that compared with participants who consume less than 1 sugary beverage a day, those with higher intakes of sugary beverages were significantly more likely to have reduced brain volume on magnetic resonance imaging, MRI, and lower test scores of logical memory. Reduced brain volume and poor memory are hallmarks of early Alzheimer's disease. In conclusion, I favor Bill number 19050 based on medical and scientific evidence. I wish to thank Councilmember Blondell Reynolds Brown for sponsoring the bill and for more than 4 decades of service to the city. Thank you for your kind attention.
Thank you for your testimony. Councilwoman Brown?
Thank you for the acknowledgement of the work that my staff and I have done. It's always been a team effort, and we rely on experts to help us and guide us in exercising good judgment when it comes to policy. Thank you for the acknowledgement.
Thank you. Is there anyone else here to testify on Bill number 190-505? Anyone else here to testify? Okay. Yeah, so Councilwoman Brown would like to be recognized. Okay. Okay, we are now going to go into a public meeting and motions for Bill number 190505. The chair recognizes Councilwoman Blondell Reynolds Brown for a motion to amend Bill number 190505.
Thank you, Madam Chairwoman. I would like to offer an amendment to Bill number, is it amendment or amendments? 190505, a copy of which has been circulated to all members of the committee. And before we act on the amendments or adopt the amendments, I'd like to speak on them.
Okay, Councilwoman Brown, if you want to give your commentary now.
Yes, please, thank you.
Please.
So, the amendment includes technical changes that clarify a restaurant's ability to list all healthy beverage items on its menus. One of the lessons learned from my menu labeling bill was that it does take restaurants time to make adjustments on their menus, and so we're going to delay the implementation to give restaurants adequate notice to update their menus with these new healthy options. Additionally, after again speaking and meeting with a number of stakeholders, the American Association of Pediatrics, the Robert Wood Johnson Foundation, the United States Department of Agriculture, as well as stakeholders right here in our community, and I do want to include and acknowledge Coca-Cola, who sat down with us as well to help us come to some more than common understanding. In this case, we found some common ground. This bill also expands the type of beverages that can be included on a child's menu to include low-fat chocolate milk, under 130 calories, and 100% vegetable juice. So we believe that this amendment seeks to, we believe that we are now striking a delicate balance between enabling restaurants to provide the options to families and ensure that those options have healthy nutritional value. So while not 100% on all sides, we found a delicate balance in between the two, and I want to thank my staff and those stakeholders for that. So now, having spoken to the details of the amendments, Councilwoman, I would like to see us adopt the amendments, period.
Second.
Okay?
Okay, it's been moved and probably seconded that the amendments that were just circulated be adopted. All those in favor of the amendment signify by saying aye.
Aye.
Any opposed? Okay, no. The chair recognizes Councilwoman Blondell Reynolds Brown for a motion on Bill number 190505 as amended.
Thank you, Madam Chair. I move that Bill number 190505 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended so to permit first reading at our next scheduled session.
Second.
Okay, it's been moved and properly seconded that Bill number 190505 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All in favor will signify by saying aye. Aye. Anyone opposed? No? Okay. The ayes have it and the motion carries. Bill number 190505 as amended will be reported from this committee with a favorable recommendation with a request that the rules of council be suspended to permit first reading at the next session of council. This concludes our business for the Committee of Health and Human Services. Thank you for attending.